Good morning. My name is John Gaudette. I'm the organizing director of Citizen Action Illinois. And today I'm joined by Penny Richards, President-elect of the Learning Disability Association of Illinois, Mr. Abe Scar, Director of the Illinois Public Interest Research Group, Illinois PIRG, and Dr. Peter Horos, Professor and Chief of Service for Occupational and Environmental Medicine at the University of Illinois Hospital and Health Science System, which is a mouthful. So today, we are here to call on Walgreens to stand by its commitment to remove toxics and dangerous chemicals from everyday product on its shelves. We are delivering 135,000 petitions from across the country, including 15,000 from customers here in Illinois. We're calling on Walgreens to adopt a comprehensive policy to phase out toxic chemicals in products like cosmetics, children's toys, and cleaning products, many of which you can see here today. Last July, we stood here as part of a national day of action, asking Walgreens to come up with a policy. In December, Walgreens finally made a commitment to come up with a comprehensive policy to remove toxics in its stores. Today, we are giving a gentle reminder to Walgreens as to the importance of this commitment and the urgency of the problem. Toxic chemicals are commonly found in retail store shelves, have been linked to serious health problems that are on the rise, including cancer, learning and development disabilities, and reproductive harm. We know chlorine and PVC causes cancers in children and adults, and we know lead leads to memory loss, learning problems, and anemia. We know phthalates are hormone disrupting chemicals that interfere with male reproductive systems. These are some of just 3 samples of the toxics on their shelves. Do these sound like the kinds of things you'd expect to find on the corner of Happy and Healthy? Of course not. We want to make sure their plan addresses the unique vulnerabilities facing infants, young children, and pregnant women. We are hopeful that Walgreens will do what's right for our children and our families. Now first, we'd like to hear from Penny Richards from Learning and Disability Association of Illinois. Penny?
Thank you, John. Again, my name is Penny Richards. I'm a board member of the Learning Disabilities Association of Illinois. I'm here today as a mother of an adult son with a learning disability and grandmother of a child with ADHD. My grandson's ADHD interferes with his learning and causes behavioral concerns. He is currently making straight A's in special education due to the program of special education that he's been in since he was 3 years old. He currently wants to be a special ed teacher so he can help the kids. Mounting scientific evidence shows that toxic chemicals in consumer products are harmful to children developing brains. Some of these chemicals also disrupt the body's thyroid hormones and are linked to cancer. I myself am a thyroid cancer survivor. These chemicals are found in lotions, shampoos, toys, and plastics, and cleaning products. Pregnant women, babies, and children are most at risk from exposure to these toxics. Parents should not need a degree in chemical analysis in order to purchase products safe for their children. We urge Walgreens to adopt a strong policy that ensures the products they sell are free of chemicals that can harm our children's developing minds and bodies. LDA is glad that Walgreens is taking the issue of toxic chemicals in products seriously. We look forward to seeing their new chemical policy soon. Thank you.
My name is Abe Scar. I'm the director of the Illinois PIRG Education Fund. We're a statewide, nonprofit, nonpartisan public interest advocacy organization. I want to thank Citizen Action Illinois and the Safer Chemicals Campaign for their leadership on this issue, as well as my fellow speakers here today. Our lax federal laws on toxic chemicals have allowed toxic chemicals into our products, our stores, our homes, and our bodies. We all want to keep products that are unsafe away from our families, but we can't do it alone. And that's why we're calling on Walgreens to take products that contain toxic chemicals off their store shelves. Toxic chemicals that are commonly found in consumer products have been linked to serious health problems that are on the rise, like cancer and asthma. One example are chemicals that release formaldehyde, which is linked to things like respiratory problems for children and is an asthma trigger. In the absence of federal action on toxic chemicals, some industries and businesses are taking the lead. For example, Johnson & Johnson has removed chemicals that are released formaldehyde from all of their children's line of products, and big retailers like Walmart and Target have adopted comprehensive toxic chemical policies. We're pleased that Walmart has begun the process of developing a comprehensive toxic chemicals policy, but we need them to do more. As the nation's largest pharmacy, Walgreens is in the business of health and wellness. As their sign over here says, they're at the corner of happy and healthy. Well, happy and healthy does not include toxic chemicals, so we are calling on Walgreens to take action now. Thank you very much.
Thank you. My name is Peter Horos. I'm a physician in Chicago. I am an internist. I practice internal and occupational environmental medicine. I'm professor in chief of occupational and environmental medicine at the University of Illinois Hospital and Health Sciences System. And I'm here today to continue to applaud Walgreen's commitment to taking a comprehensive preventive approach to the exposure and the potential exposure to our patients to the kind of toxic chemicals that are contained in some of the products that are currently being carried. And I'm hopeful that with their announcement this spring or early summer of a comprehensive approach that will take some of these products off their shelves, it will reduce the number of patients that we're seeing, both children and adults, that are suffering from the toxic effects of these kinds of toxic components of their chemicals. And I'm here as well to assure them support in the healthcare community for just such a preventive approach in removing these chemicals and joining some of the other healthcare providers and healthcare supply providers in removing these kind of toxic chemicals from their consumer products. So again, I'm very happy to be joined by the thousands of signatures of their customers and want to assure them of the support of professionals in this area. Thank you very much.
So I'd like to thank all the speakers today. What we're going to do now is we're going to walk to the door and meet the manager and drop off the 135,000 signatures we have. And you know, this has been a 2-year fight to change the culture of Walgreens, and we're glad that they're taking steps. And we hope that they catch up to their new bosses at Alliance Boots, who have a strong policy. And we hope that they catch up to other retailers like Walmart, Bed Bath & Beyond, and Target to take action and move a little faster than they are right now. And so we want to make sure that they understand the importance and the desire for us to keep pressure on them until they come up with the right solution. And we expect something in the next couple months. And we're happy to join Walgreens on the corner of happy and healthy. Obviously right now they're on the corner of dangerous and harmful, and we hope they move soon and join us here. So thank you for coming today.